my name is Rachel. I'm going to be your nurse today, and we're going to be doing a head-to-toe assessment. And I'm going to start with some hand hygiene. I'm washing my hands, and I'm talking to my patient. Hi, how are you doing today?
Doing well.
Doing well. Do you have any pain?
Just a little bit from a long hike yesterday.
Oh, okay. And do you have any allergies?
Not that I know of.
Oh, good. And what was your name and date of birth?
November 11th, 1964.
Okay. All right. I'm taking a look at the patient's hand, and I'm checking for name and date of birth. Great. Do you know where you are?
Yes, I'm in Winchester, California.
And what time is it?
It's about 3:30 in the afternoon.
And what are you here for?
I'm here for enjoyment. It's my home.
Okay.
And my name is Karen Mackey.
Great. Patient is alert and oriented times 4. Okay, I'm going to give you 3 items. I need you to tell me back, and you're going to have to remember them at the end of the assessment. Light, tight, and dynamite.
Light, tight, dynamite.
Great. Patient can articulate. Speech is clear, ungarbled. Okay. And I'm now going to be taking a look at your head, and I'm going to be feeling around for any abnormalities. Okay, so I'm looking at the skin, and I'm looking at the hair distribution. It's equal, it's generalized, and I don't see any lesions. I'm not seeing any bumps, bruising. Skin is intact. Okay, and now I'm going to be looking at the face symmetry, and I see that it's symmetrical. I don't see any drooping on either side. The eyelids are not drooping. The eyebrows, the growth is full and it's equal on both sides. Eyelash growth is normal as well and adequate. And the skin is pink and it's warm, and the temperature, like I said, the temperature is good, and it's free of lesions. Okay, now I'm going to be palpating for facial sensation. Can you feel that?
Yes.
Okay, and there's no sensitivity, right?
No.
So there's sinuses. So there's no sensitivity right here on our sinuses, and also there is no pain or sensitivity when I'm touching your scalp here. No. Okay, good. Okay, now I'm looking at the eyes here. Okay, and I'm going to pull them down, and the sclera is white, conjunctiva pink. Okay, and would you say that your vision is clear? There's not blurred?
Yes, it's clear and there's no drainage.
There's there's no drainage. That's right. And do you wear eyeglasses?
Yes, I do.
Okay, great. Thank you. I will note that. And I'm gonna have you take a look into my little light here. Okay. And I need you to look at my finger and follow it with your eyes. Okay. Okay, now look at my finger again and look at the back wall.
Okay.
Okay, so eyes are perla. Okay, so their pupils are equal and reactive to light and accommodation. Okay. Yeah, pupils are 3 millimeters. Okay, and let me take a look at your ears now. And I'm looking and inspecting the skin. No breakdown, no lesions, no redness, no flushing of the ears or on the face. And is there any pain or tenderness?
No, in either ear.
No? Okay. All right. There's no drainage. Okay, no drainage. And I'm going to ask you to repeat a few words that I'm going to whisper, okay?
Okay.
So go ahead and take your finger and close one ear. Okay.
1, 2, 3.
Okay, now the other side.
4, 5, 6.
Okay, great. So hearing is intact. Okay, and I'm going to go to the nose, and the nose is symmetrical. It's straight, and inside it's pink, moist, no polyps. Would you say that your sense of smell is regular?
Yes.
Okay, and the skin on the nose is pink. It's warm. Temperature is warm. It's dry. I see that there's no cracking of the lips. And oh yes, go ahead. Can you There you go. And do the other side now. We're gonna breathe in and out. Great. Okay, so the nose is patent on both sides. Okay, with both nares. I don't see any cracking of the lips, and the moisture is adequate. Can you go ahead and open your mouth? Okay, so I don't see any bleeding of the gums. There's no dentures. The tongue is not swollen. It's pink and moist there, and free of lesions. Okay, and there's no foul odor. Okay, and I'm going to be now taking a look at your neck, and I'm inspecting. There's no jugular vein distension. The trachea is not deviated. I'm gonna feel for the carotid pulses. Regular +2, and I'm feeling for the lymph nodes. Is there any sensitivity
No.
there? No, okay. And I'm gonna ask you to go put your head up and then down and to the side. And the other side. Okay, now can you do a shoulder shrug for me? Okay, now can you go up with your arms? Okay, now to the side, up to the side. Okay, okay, very good. I'm gonna check your turgor here, a little pinch. Turgor is good, no tenting. All right, and I'm going to be looking at your upper extremities. I'm looking at the skin. It's pink. The temperature is good. I'm not seeing any skin breakdown. The skin is intact. Okay. Now I'm going to be palpating, and I'm feeling. Is there any pain or tenderness when I do that? Go ahead and
No.
relax. There's no pain or tenderness. Great. Okay. And I'm going to be feeling for the radial pulses. Regular +2, and I'm checking the capillary refill in all fingers. Okay, can you go ahead and grab my fingers here? Okay. Okay, oh, thank you for pulling on them too. Okay, now can you go like this? Okay. Okay, now go ahead and do that again, like this, just like that, and now pull against me. Great, okay. Now can you put your arms all the way up, to the side, down. Can you go like this? Okay, so patient has full range of motion. Their muscle strength and resistance is adequate. Their capillary refill was under 3 seconds in all their fingers. And now we're going to be looking at their chest and thorax and their heart. And I'm noting adequate rise and fall of the chest. There's no use of the axillary muscles there. And I'm going to ask my patient, do you have a history of smoking?
No.
No. And have you had a cough recently?
No.
No. And if there was a cough, I would ask if it was productive, their sputum, what color that would be. And I'm going to taking a look and see if there's any surgical scars. Have you had any surgeries?
No.
From the heart? No. Okay. From the heart. And I'm looking at the skin. There's no bruising, no bumps, and I'm palpating for any lumps. Okay. Okay, so no abnormalities there. And now I'm going to be listening to your heart tones. Okay. And I'm first going to be taking a look at your apical, not your apical, sorry, your aortic, second intercostal space, right sternal border, pulmonary, second intercostal space, left sternal border, third intercostal space, left sternal border would be the Erb's point. Then the tricuspid is the fourth intercostal space, and the mitral, which is also apical, is the fifth intercostal space. Okay, and all heart tones are regular. I'm not hearing any extra heart tones, no murmurs. And now I'm going to be taking a look at your lung sounds, and we're going to be doing 6 on the front here. Okay, And here we go. When I touch your chest with my stethoscope, I need you to do a deep breath for me. Okay, so lung sounds are clear. There's no rhonchi, wheezing, rales. Okay, and now we're going to be looking at your back. If you can go ahead and put your dangly legs over here. Okay, and I'm noting the skin for any breakdown, any abnormalities. There are none. The skin is warm. The skin is pink and dry. And I'm going to be looking at the spine. The spine is straight. Okay, and I'm going to be going down the spine. Can you feel any sensitivity when I do that?
No.
No, if you do, let me know. Okay, now I'm looking at the muscles. Is there any sensitivity?
No.
No, okay. So, great. And now I'm going to be listening for 8 lung sounds on the 8 lung fields. Okay, great. Lung sounds are clear. No wheezing, no rales, no rhonchi. Great. Go ahead and get yourself comfortable again. Okay, now we're going to be going to your abdomen. And right now I'm inspecting you. Haven't had any abdominal surgeries?
I had a C-section many years ago.
Okay.
Plus 30.
Okay, we'll note that. And I'm inspecting for any bulging masses, any bumps, any bruising, any abnormalities. The skin color is normal for ethnicity, and I'm going to auscultate now for the bowel sounds, starting the right lower quadrant. Bowel sounds are present in all 4 quadrants, and I'm going to palpate now to see if I feel for any lumps. Is there any pain or tenderness when I do that?
No.
No sensitivities. So have you had any stomach upset
No.
or any nausea recently? No? Okay. And when was your last bowel movement?
This morning.
Was it normal for you?
Yes.
Okay. And your last urination?
Yes, about 3 o'clock today.
About 3 o'clock today? Okay. And was it normal? Was the color, what was the color?
It was yellow.
It was yellow. Okay. Dark yellow, light yellow?
It was probably a medium yellow, clear.
Okay, great. And was there any difficulty urinating?
No.
No hesitancy?
No.
No pain?
No.
Okay. Okay, good. Now I'm going to be looking at the perineal area, checking for any skin breakdown. I'm looking for cleanliness, Foley catheter. If there is Foley catheter, then I'm going to look for patency and cleanliness as well, and assess that if needed. And I'm going to be looking at all the extremities and specifically the skin right now. And I'm going to be checking the coccyx for any skin breakdown and the buttocks. I'm going to be looking at them to make sure there's no breakdown. And I'm looking at the skin, and the skin, there's no lesions, there's no breaking of the skin, and the skin is warm, it's pink, it's not clammy, it's dry, and there's just this one little wound right here, which I will note there on the knee, and I'm palpating. Is there any sensitivity?
No.
No sensitivity. Okay. Okay. Very good. And I'm especially noting the calves for any redness, heat, or swelling. Okay, that would be important. And I'm checking the heels here and the feet for any breakdown, okay, on the bony prominences. There is none, okay. And I'm going to be checking your dorsalis pedis pulses. They are regular +2, and I'm going to be checking your capillary refill on all your toes. catheter refill is under 3 seconds in all toes. And can you go ahead and push down on the gas? Now pull your foot towards you. Okay. And now can you, I'm gonna check your range of motion. I'm gonna check your range of motion, and we're gonna go ahead. I need you to push down on my hands. There you go. Now pull and then go up towards me. Great. Okay, now I'm gonna take your leg and we're gonna go out like this, and then we're gonna bend your knee like this. Okay, now, and then we're gonna go around. Great. Okay, down. Okay, now we're gonna go up like this again, and then we're gonna go out, and then we're gonna go around. Great. Okay. Patient has full range of motion in all her lower extremities. Her muscle resistance and strength is normal and adequate. And I'm going to be asking the patient about any pain. Do you feel any pain?
No.
Okay, great. And do you feel safe at home?
Yes, I do.
And you don't have any thoughts or feelings that you would want to hurt yourself or others?
No.
No. Okay, good. And can you give me the 3 items that I told you in the beginning?
Yes, light, tight, dynamite.
Great. Short memory is intact, and I'm going to be asking my patient, do you need anything? Do you need to use the restroom?
No.
No. Okay. And I'm going to be making sure that your call light is in reach, and the bed is low and locked, and the rails are up. You're going to say, right, you have liquids to drink if that's if you would like, or if you're able. And I'm going to say thank you.
Thank you.
And I'm going to wash my hands and leave.